Dr. Riddle, thank you so much for taking the time to meet with me today. I understand just recently in February of 2024, one of your papers entitled Comparing Eating Disorder Treatment Outcomes of Transgender and Gender Diverse Adolescents with Those of Cisgender Adolescents was published. Can you tell us a little bit about that publication?
So one of my interests when I came here, and I'm a psychiatrist, I'm caring for patients every day. And I noticed that particularly at this site, we have a lot of transgender and gender diverse individuals in both our adult and our adolescent programs. And I was really curious about how do they do compared to their cisgender peers, because there really isn't much in the literature about
Mhm.
that. There's really just sort of a lack of data, and we know that most of the eating disorder treatments and systems were created through a cisgender lens and sort of with cisgender patients in mind, and that
Mhm.
sort of limits our understanding of how marginalized individuals, such as gender diverse folks, experience care, and if they sort of get the same benefits out of care, for example, that we see with our cisgender patients. So that was sort of the premise for asking this question, like just how do they do? What do they look
Right.
like when they come in? And how do they look by the time they discharge from our care?
And really getting at the question, is the care that we're providing equally efficacious? Or is there
Exactly.
something different that needs to be considered with
Yeah.
different populations?
Right. And
So,
are there ways that we need to further individualize our treatment to make sure they're getting the most benefit they can out of it?
well, and I realize you had a whole lot of co-authors and lots of people that helped contribute to this, but can you tell us a little bit about kind of what you saw in this outcomes paper that was published in the International Journal of Eating Disorders?
Yeah. So it was, one of the things about being a researcher is you sort of come in with a hypothesis, you have an idea about what your outcomes might look like, and then the data sort of will be what it is. And sometimes you're wrong with your hypothesis. And in this case, we were wrong with at least part of our
Hmm.
hypothesis. So we sort of proposed, or we thought, given the literature, that the transgender and gender diverse kids might come in more sick and do less well with regards to
Okay.
eating disorder care. And actually, what we found is that they come in with sort of a similar severity with regards to their eating disorder symptoms when you compare them with their cisgender peers. And they actually experience a similar level of improvement with
Oh,
regards to their eating disorder symptoms, which is great news. It's always good to know that, your patients are improving with what you're doing. Where we did find some differences was with regards to depression and with regards to, anxiety and suicidality. So, for example, with depression, they come in more depressed, according to sort of the measures that we take. And they do have improvement in their depression symptoms, but they are still more depressed at the time of discharge compared to their cisgender peers.
okay.
Similarly, with suicidality, we see some improvement, but they're still more suicidal at the time of discharge than their cisgender peers, which for us really suggests, hey, we might need some targeted treatments for these individuals to help with things like depression and suicidality. Because what we're seeing is, yes, they're getting some benefit from our care for that. They're still struggling at the time that they leave.
And you had mentioned that there's not a lot of research published on transgender or gender diverse patients with eating disorders, but you've actually published four papers with your co-authors on this topic. Can you talk about some of the other publications and what you've seen?
Yeah. So this sort of goes back to what you can do when you have a lot of patients in care. Because I think a limitation in the research has been that there just aren't as many transgender individuals in care. And so sometimes getting enough to actually look at them as an individual cohort and not say lump them in with other members of the LGBTQ community have been tricky. So we have enough numbers to actually look at them separately, which is fabulous. So in addition to the adolescent paper, we also looked at adult outcomes, which actually was fairly similar with
Mm.
regards to they enter into our care with similarly severe eating disorder symptoms to their cisgender peers and experience a similar level of benefit. Like their eating disorder is significantly better at time of discharge and not different from their cisgender peers. But again, we saw less responsiveness with regards to like depression and suicidality, which would again suggest sort of the need for some of those targeted treatments in adult patients as well. So the pattern was a little different. Don't need to
Mhm.
necessarily get into the details, but in both cases, eating disorder symptoms improve quite a bit, and depression, suicide, anxiety may benefit from some more targeted treatment.
Well, Dr. Riddle, thank you very much again for taking the time to work with us today. And in closing, I appreciate the fact that I know you're busy seeing patients as a staff psychiatrist and the medical director of our Bellevue facility. So thank you for your time.
Absolutely. Thanks for having me.